Hi, Dr. Todd Sullivan from Nova Chiropractic and Acupuncture. With the COVID-19 pandemic upon us, one of the tests that they're looking to issue a lot for people around the country is the antibody testing. The antibody testing is important because people that are asymptomatic, that may not have gotten the actual coronavirus test, now can get the antibody test to see if they've been exposed to it. So they may have had that, been asymptomatic, but this will tell us how many people are infected with this. So with the antibody testing, there's two antibodies that they're testing for. One is IgM and the other one is IgG. The IgM antibodies are present early on in the infection. So after about 5 days of the virus being in your body, they can detect the IgM antibodies. And then they start to die out, the IgM. And then the IgG antibodies come in after the IgM, and that's where they're going to be present in your system more of a long-term basis. So what we're going to do today is we're going to be testing Natasha for her IgG antibodies. I'm going to show you that process and what it looks like. It takes about 10 minutes, and the test that we have is a finger prick test. Now, some of the tests that are available will also test IgM and IgG. The test that I have is just going to be testing the IgG antibodies. What we have is we have the IgG test kit. We have the solution that we're going to mix the blood with. We have a lancet we're going to prick her finger with, and we have an alcohol swab and then a Band-Aid. So what we're going to do is we're going to open up this kit first here. There we go. Perfect. Okay, so we have, this is the IgG antibody test. So what we're going to do is we're going to take this lancet, we're going to pop that off. We're going to open up this bottle because we're going to eventually put the solution in there. Okay. Okay, so what we're going to do in this case, we're going to do it on her index finger here. So what you want to do is you want to wash her hands. She's already washed her hands. We're going to kind of focus and massage the finger so the blood is kind of concentrated in there. You'll see me massage that in a second here. So what we're going to do is we're going to got her finger. Good. And in the instructions, it shows that you want to get the end of the pipette here with the blood. Okay. Just gonna get a little bit more. Okay. Okay. So now what we're going to do is we're going to mix this thoroughly. And then what we're going to do is we're going to put 2 to 3 droplets of blood on the actual test kit itself. And then what that's going to do is going to show up on this middle section here. There's going to be a control line, and then there's going to be a test line. The test line will tell us if she's had COVID-19 and she's had antibodies to it. So we're going to take some of that solution here. And again, we only need 2 to 3 droplets. That's it. So now what is happening is the blood is going to go along this test here, and it's going to show us, the control line will show up. It's like a pregnancy test, essentially. So you're going to see a line that's going to show up for the control, and then we're going to see a line that's going to show up if she's had COVID-19 and she's developed antibodies to it. Okay, so we're going to wait 8 to 10 minutes, and then we're going to see the results. So I hope that illustrates how a COVID-19 antibody test would be performed and what it looks like to have it done. Honestly, it takes about 10 minutes to do. It's real easy. You should be able to get this from any of your healthcare providers in the future here as they're ramping up all the testing. and it should be widely available for everyone. And I really think this is going to be the best way to see how much of our population has been exposed to it, and actually what the survival rate of this virus is, because we may find out that a lot more people have been exposed to it, and actually the numbers comparison to the people that have died is actually really low. But we'll see. I mean, this is going to be the really important test to see that. If you have any questions, reach out to me at 703-912-7822, or you can always schedule an appointment at novachirowellness.com.